My name is Sarah. I am 24 years old and I will share the story of how I contracted AIDS and how it changed my life. AIDS, or the Acquired Immunodeficiency Syndrome, is a fatal disease caused by a virus called the HIV that attacks our immune system. I have always been a cheerful person, enjoying life and even topped at university. However, everything changed when I met Tom. He was handsome and we soon started dating. Everything went very fast. I was so much under his charm that I could see nothing negative, not even the fact that he was a drug addict. He soon took me in his dark world of drugs and introduced me to his friends who were also drug addicts. This was the downfall. We began taking drugs by intravenous means and by sharing syringes. I also had recourse to unsafe sex several times. Soon after, I started falling sick, experiencing flu-like symptoms such as fever and dry cough, headache. Sometimes I had constant headache the whole day. Nausea and vomiting was the worst. This was followed by a large and painful period of joint pain. And eventually I got a spread of rash all over my body. Loss of weight was the most apparent of all signs and symptoms, and I began resembling a sick person. I eventually went for a blood test and was tested HIV positive. That was a tough punch for me and a shock, but unbelievable just happened. And unfortunately, that was just the beginning. What followed was worse. I confided to one of my best friends at university, but the news spread like wildfire. All my friends rejected me. When I went for lunch at the canteen, everyone would leave, and that made me close myself even more. All this led into a severe depression that impacted my studies. However, I somehow managed to pass my exams and got my degree. Immediately afterwards, I began looking for a job. I was called for several interviews, and the interviewers always seemed very interested and pleased, and my interviews would go very well. However, I would always get a negative answer after viewing of my medical reports. I am still jobless as today, but have joined an anti-AIDS association. The reason behind this was to sensitize youngsters about the disease, as well as its preventive measures, and prevent them from going through what I went through. In my case, the HIV virus was transmitted primarily through blood, that is by sharing of syringes. So the first preventive measure is no sharing of injection drug equipment such as needles, because you do not know if your friend has HIV. I also had unprotected sex with an HIV positive person, so that virus was also transmitted through semen. To further reduce the risk of HIV infection, it is best to use condoms correctly. It is also a good idea to book an appointment at the clinic for routine checkups. If you are going for a tattoo, make sure that the person is using sterilized needles and wearing gloves. If a woman is infected with HIV/AIDS during pregnancy, her risk of transmitting the virus to her baby is reduced if she stays as healthy as possible. Another aim of sensitizing people has also been to remove some misconceptions people may have about HIV. A lot of people think they can catch HIV by simply shaking hands, hugging, or kissing a person infected with HIV, but that is not the case. Anybody can catch HIV, so it is best to be aware of how to protect oneself.